Good afternoon, everyone. In the interest of time, I have 12 on the dot, so we're going to go ahead and get started. Welcome to the webinar on tobacco cessation in Minnesota, an overview for behavioral health organizations. My name is Janelle Kwashinsky, and I'm the Senior Manager of Tobacco Control at the American Lung Association in Minnesota. This webinar, subsequent webinars, networking calls, and in-person trainings are all part of the American Lung Association's commitment to decrease tobacco's significant and disproportionate impact on people with mental illness or chemical dependency. If you are an organization treating patients with mental illness or addiction and are interested in hearing more about the services a partnership with the American Lung Association can provide, I will be going over some of the options at the end of the presentation today. Before we get started, we just have a few housekeeping items to cover. Right now, all lines are muted. If you have a question during or at the end of the presentation, please chat it into the chat box. We will answer questions at the end of both Amanda and Jamie's presentations. Today's presentation is also being recorded. Following the webinar, an email with the recording, a link to the slides, and other tools will also be sent to all registered attendees. I'd now like to introduce Amanda. Amanda Jansen is a Senior Cessation Manager at ClearWay, Minnesota, an independent nonprofit organization that improves the health of all Minnesotans by reducing tobacco use and exposure to secondhand smoke through research, action, and collaboration. Ms. Jansen leads the ClearWay Minnesota Cessation Policy initiatives focused on ensuring access to comprehensive tobacco dependence treatment for all Minnesotans. She spearheads policy efforts to improve health insurance benefits for tobacco cessation and to strengthen tobacco-related health care quality measures. Ms. Jansen has extensive expertise in state-level implementation of health care reform initiatives, including the Affordable Care Act. Prior to joining ClearWay Minnesota in 2010, Ms. Jansen was a public health research and policy consultant focusing on policy, systems, and environmental changes at the community level. Ms. Jansen earned her bachelor's degree in psychology from the University of Wisconsin-La Crosse and her master's degree in public policy from the Humphrey School of Public Affairs at the University of Minnesota. And then after Amanda today we'll hear from Jamie. Jamie Andika is the Health and Wellness Project Manager at People Incorporated Mental Health Services, where she works with staff and clients across the organization to integrate whole health and well-being services into a behavioral health setting. Areas of focus include nutrition, movement, mind therapies, sleep hygiene, diabetes prevention and management, and tobacco treatment. Jamie has a BA in sociology and a master's in public health with a focus on chronic disease education, prevention, and management. Jamie is also a certified tobacco treatment specialist and works with clients and other stakeholders to reduce tobacco use and the harmful effects of tobacco on individuals and communities. I'd like to now hand it over to Amanda to kick off our presentation today.
Thanks, Janelle. So as Janelle mentioned, my name is Amanda Jansen, and today I'll be talking a bit about tobacco cessation services in Minnesota. So today I'll be covering a few things. First, what the Affordable Care Act says about tobacco cessation and how Minnesota has implemented those requirements. Second, for Medicaid and Minnesota Care, what providers can deliver treatment and how to seek reimbursement for doing so. Third, I'll talk a bit about Quit Plan services, which are free services available to everyone who lives in Minnesota. And finally, I'll cover the Call It Quits referral program, which is a way to get your patients to phone counseling services. So first, the Affordable Care Act and tobacco cessation. So the ACA, or Affordable Care Act, says all preventive services graded A or B by the United States Preventive Services Task Force must be covered in most insurance products without any cost to the patient. I say most insurance products because some products are still grandfathered in and don't yet have to comply with this component of the Affordable Care Act. So tobacco cessation was rated A. It was also initially unclear how this rating or the recommendation was to be translated into insurance coverage. But thankfully, it's now been clarified and updated. So in fall of 2015, the Preventive Services Task Force updated the cessation intervention rating, clarifying that all types of counseling, so individual, group, and phone counseling, and all FDA-approved cessation medications are included in their rating or recommendation. So because of this, most health insurance products that have to comply with the Affordable Care Act that started after October 1 of 2016 must comply with the updated rating, so must include all forms of counseling and all types of medications. Here on the screen is a link to a nice fact sheet here from the American Lung Association that summarizes this change and what it means for insurance coverage. And we'll send this fact sheet out after the webinar as well. The preventive services requirement also applies to a portion of the Medicaid population. We leverage this in Minnesota to remove copays on cessation medications for all Medicaid and MinnesotaCare enrollees. So as of January 1 of 2016, all enrollees have free coverage for individual and group counseling and free coverage for all 7 FDA-approved medications, including nicotine replacement therapy and prescription medications like Chantix. Enrollees also have access to phone counseling, either through their health plan or through Quit Plan services. We've also done some work to close coverage gaps in other insurance products that are regulated by the state of Minnesota. Generally, this is the coverage landscape as it looks today. I already covered medical assistance in MinnesotaCare. For the state employees of Minnesota, they now also have a comprehensive benefit. Most commercial insurance regulated by the state has a comprehensive benefit. The largest piece of variation will be with people who get their health insurance from very large employers who manage their own health insurance products. About 40% of Minnesotans are insured through one of these employers, so because of this, there may still be a lot of coverage variation among these individuals. Here are some future opportunities to increase access to cessation coverage. First, we can close existing gaps in medical assistance in MinnesotaCare by adding a phone counseling benefit across everyone, ensuring consistency across the health plans in duration and length that medications can be used and covered, allowing the use of multiple medications at once, otherwise known as combination therapy, removing other barriers such as prior authorization or limits on the number of times someone can try to quit each year. Second, there are still things to be done to fully implement the Affordable Care Act's requirement in the private insurance market. Minnesota could have stronger processes for reviewing health plan products to make sure that they meet these high ACA standards. Third, we could expand the types of providers that are eligible to deliver cessation services. For example, pharmacists could be able to prescribe cessation medications, or tobacco treatment specialists could be able to get reimbursed by all the health plans for delivering counseling services. Finally, we can continue to promote services to both providers and patients. It's really important for providers and patients to know what cessation services are available to them. For patients on public programs, they have a near comprehensive benefit. For patients with private insurance, the ACA can serve as a tool to push back against denial of coverage. So next I'll talk about a little bit about eligible providers and reimbursement as it has to do with medical assistance in MinnesotaCare. So here's a summary again of what's covered under MA and MinnesotaCare. There will still be variation depending on what health plan manages the benefits. Examples of things that will vary still include number of weeks of each medication that might be covered, whether or not prior authorization is needed for certain medications, the number of times someone can try quitting each year. The cost of these services to the patient, however, should always be free. Cost should not be one of the things that varies. So this is the chart included in a provider fact sheet that we'll send around also after this webinar. You'll see the billing codes listed there in the middle. These codes can be used for all Medicaid and MinnesotaCare enrollees, and they have to do with delivering face-to-face individual tobacco cessation counseling. To the right of that code list is a list of eligible providers. These are the providers that can bill for delivering tobacco cessation counseling to fee-for-service enrollees only. So the health plans determine eligible providers for the managed care enrollees. The eligible providers, as defined by the health plans, may or may not be the same as this list. It's important to check with the individual health plans about which providers can bill for delivering tobacco cessation counseling for your Medicaid enrollees. In 2014, we were successful in getting tobacco treatment specialists added to the list of providers who can bill for delivering cessation counseling to fee-for-service enrollees. So physician extenders are healthcare professionals who provide treatment under the supervision of a physician. So examples of physician extenders include physician assistants, nurses, and pharmacists. This policy change allows more types of healthcare professionals to be able to bill for delivering these services, such as a social worker who maybe is also a tobacco treatment specialist. So now I'll move on to Quit Plan services, which are free cessation services available to anyone who lives in Minnesota. So Quit Plan services can start with either a phone call or a visit to our website. This is our website. There's no need to register to have access to a lot of the information that's on the website. So it's a great place for patients or providers or other clinic staff to start. The content is robust and includes 3 key sections: thinking about quitting, how to quit, and services to help. Within each section, there are articles, information, and interactive tools based on what we know helps people move through the quitting process, and it gives them skills and tools they need to quit. The entire site is also available in Spanish. We also recently added a Google Translate feature, which you'll see in the upper right corner where it says select language. We have 2 programs, individual quit plan services and the quit plan helpline. First, I'll talk about the individual quit plan services that we offer. Sorry, my slides aren't advancing, Janelle.
I think it just did.
There
you
we
should
go.
see it now. Okay.
Awesome, thanks. So individual quit plan services are available to all adults who live in Minnesota. So they include a starter week of 2 weeks of NRT, text messages program, and an email program, as well as a quit guide. Participants can choose what they want and can come back to add more if they change their mind later. Oops, there we go. And now I can talk about, I'll go into each one of these individual services in a little more detail. Janelle, did it advance on your end? Because it's not advancing on my end.
We have 2 weeks patches, gum, or lozenges up top.
Okay, so first is the starter kit. It's intended to give all tobacco users the opportunity to give quitting a try. It includes 2 weeks of patch, gum, or lozenge, and a follow-up call with a quit coach from the Quit Plan Helpline. Starter kits are available to adults 2 times every year. Next is our texting program, which provides support and motivation for those using cigarettes. It is available in English or Spanish. There are 300 different messages that are used in that program. The program is tailored to a quit date set by the participant. It includes daily texts, tips, games, reminders, and encouragement. It also helps track use of tobacco, urges, and cost savings to help the participant stay motivated. Minnesotans can enroll once per every 12 months and can easily opt out if they so choose. Next, the email support program is a series of informational and motivational emails to support participants with their quit attempts or to get them thinking about making an attempt. Participants get 13 messages over 24 days. The messages include keys of successful quitting, tips on coping with urges and managing stress, and general support. Next, our quit guide. So tobacco users said they wanted something to refer to, so the quit guide is available either as a hard copy or in PDF form on the website. It serves as a resource for anyone who is at any stage of quitting. There's also supplementary material available by mail that's listed on the right-hand side of the screen here. QuitPlan also has a few other resources to engage users, such as an interactive Facebook page, as well as a free mobile app. So now I'll talk about the QuitPlan helpline, which has been in operation since 2001. QuitPlan helpline is our most intensive service. It's available to anyone who lives in Minnesota and does not have insurance coverage for phone counseling and/or nicotine replacement therapy medications such as patch, gum, or lozenge. The QuitPlan helpline also serves Medicaid fee-for-service enrollees. The QuitPlan helpline's approach includes cognitive behavioral therapy to address negative thoughts, build confidence, and cope with stress and urges, individualization for each tobacco user, and patch, gum, or lozenges. Quit coaches are trained to recognize mental disorder presentations and flex their intervention style appropriately. Quit coaches also have access to a list of mental health resources and hotlines and provide referrals as appropriate. Finally, a clinical psychologist is available to consult with quit coaches on emergency mental health crises that arise during coaching calls. The helpline can be used 2 times per year and includes everything you see here. Coaching calls include an initial intake call and scheduled follow-up calls. Participants can also call in at any time they need additional support. The individual texting and email programs can also be integrated with the helpline. For example, emails are customized to quit dates and include reminders of coaching calls and nicotine replacement therapy orders. Text messages also include medication-specific tips, coaching call reminders, and prompts to connect with a quit coach. Here's a little more information about nicotine replacement therapy available through the helpline. We've recently added in combination therapy, so for individuals who receive the patch, 2 weeks of gum or lozenges can be added for those who think that would be an extra added benefit. So enrolling in quit plan services, as I mentioned before, can be done in 2 ways, either online or over the phone with all of the numbers here. And this is both for the quit plan helpline as well as the individual quit plan services. There are also resources available for free at quitplan.com. So this includes brochures in multiple languages, in print or PDF form, and specific medical assistance brochures. These can be ordered or downloaded from quitplan.com. So finally, I'll talk a bit about the Call It Quits referral program, which is run by the Minnesota Department of Health. So everyone in Minnesota has access to free quitline support, whether it's through their health plan or through quit plan services. So Minnesota's quitline system includes both health plan operated quit lines as well as quit plan services that are operated by ClearWay Minnesota. It can be a barrier for providers and individuals to know which quit line to go to, so that's where the Call It Quits referral program can help out. So the Department of Health operates the Call It Quits referral program to streamline the referral process for healthcare providers to connect smokers to quit lines. It offers another easy, proactive cessation resource for smokers that want help quitting using phone counseling. So we currently have over 1,200 clinics enrolled in this program across Minnesota. We also recently expanded the program to allow non-HIPAA compliant organizations, so those outside of the traditional healthcare setting, to begin making referrals to the quit line via the Call It Quits referral program. This allows us to have greater reach within the community and connect more individuals to phone counseling cessation support. So how does it work? Rather than having to know which quit line service an individual qualifies for, they can simply be referred to one central fax number through this program. So referrals will be triaged to the appropriate quit line based on insurance status of that person, and the quit line will proactively reach out to the individual rather than waiting on them to contact the quit line. So for clinics also, feedback on the outcome of the outreach attempt is also sent back to the clinic. So additionally, the Call It Quits referral program uses a proactive approach in connecting with the individual. Rather than waiting for the individual to contact the quit line, the cessation coach from the quit line will reach out to the referred individual. Evidence show that this is more effective than waiting for the patient to get the help that they need. The goal of this free program is to help healthcare providers and now community-based organizations more easily connect individuals to quit line support by providing a proactive tool designed to reach out to smokers to provide telephone-based cessation counseling. The ultimate goal of this program is to increase quit attempts among tobacco users in Minnesota by increasing provider enrollment and increasing patient referrals. So you can register or update your provider info through the link that is here. After registration, you can begin referring immediately, and we'll have additional resources mailed to you. The website here also provides a lot more detailed information on the program in general. And this is an example of a fax referral program or fax referral form that your clinic or organization will use to refer patients to quit line support. And this is the contact information for Brianna Longeaway, who is the person responsible for this program over at Department of Health. So you can send any questions her way. And with that, I'll turn it over to Jamie.
Great, thanks Amanda. So again, my name is Jamie and I am the Health and Wellness Project Manager at People Incorporated. And I'm just going to spend some time this afternoon talking about putting into practice all of the information that Amanda was just discussing, and talking about how we went from last May not really having much in place in the way of tobacco policies and procedures to right now doing some really great pilot work around offering all kinds of great tobacco treatment services. So just a little bit of background for anyone who might not know who or what People Incorporated is. We are a community mental health care provider, and we operate about 60 programs throughout the Twin Cities, all pretty much every type of program you could want in the behavioral health area. We have outreach and access, supportive services and housing, including things like adult foster care, supported living, drop-in centers and community support programs, homeless outreach. We have treatment and recovery, so MICD treatment, intensive residential treatment services, and then we also have a large health and wellness component to our care, which is where my position falls in. As Janelle said at the beginning, I have a lot of different focuses around things like nutrition, physical activity, sleep, mind therapies, and tobacco, which of course tobacco is what we're going to be talking about today, and is one of the large areas we're working on tackling and increasing our services at this point. As our goal is to really take a more holistic approach, and recognizing that tobacco is something that we in the behavioral health world are really positioned well to be addressing in the care that we provide. So just to give a little bit more background about around tobacco treatment at People Incorporated, like I said, it was around last May that we entered into a partnership with the American Lung Association. Prior to that, we had pretty limited policies and procedures around tobacco treatment. Basically, it included our manual saying, no tobacco use inside programs, no tobacco use inside program vehicles, and at some of our programs, we asked clients if they were using tobacco, but we didn't really do anything with that information. We weren't tracking it. We weren't following up with any sort of treatment or therapy options. It was just kind of stopping dead in the water at that point. One thing we did do prior to May, so March of 2016, myself and one other colleague attended the tobacco treatment certification program at the Mayo Clinic. So I am a certified tobacco treatment specialist now. It was a week-long training at the Mayo. So the tobacco treatment specialist that Amanda was referring to, who is an eligible physician extender to offer tobacco treatment services, I got that certification, so I'll touch a little bit more on that later. So that was one step we had previously taken prior to entering the partnership. But what I'm going to do is just walk through starting off that May 2016 when we started this work up until now, what we've done, and then focus more on the end on some of the trial billing we've done to give you all some practical information and examples of this being in practice. So in summer 2016, we completed a full staff survey. We decided that it was really important to us not only important to us, but we knew we'd have more success implementing some policy and procedure changes around tobacco if we made sure that our entire staff was on board and offering opinions and sort of just checking in with where they were at as we went. So we did that full staff survey over the summer. I'm going to touch in a few minutes on some of what we found from that. In addition to that, we started offering ongoing training and educational opportunities based on what we found from the staff survey. Some examples are in October, we had 2 full-day trainings with Dr. Jill Williams talking about the healthy living curriculum and working with tobacco with the behavioral health population. We did motivational interviewing and tobacco training, ongoing webinars and e-learning opportunities around tobacco use and behavioral health and tobacco pharmacology, as well as ongoing opportunities and trainings around People Incorporated's internal policies and procedures and forms. So how we are actually implementing things within our program. In the fall and winter of this last year, we updated our Evolve medical record system to be able to offer tobacco treatment in a sustainable way. So we created a tobacco screening that we use with all current and future clients. And that was created based off of looking at several other examples and consulting with the American Lung Association and other organizations to create a screening that really worked well. It's fairly quick and can be done in the intake process. So we have that. We created a standing order for tobacco treatment medications and individual and group treatment. This is another really big step for us. On the standing order, we can order any of the 5 NRTs. Currently, it does not include Chantix or bupropion, just the NRTs. And we also created a billable tobacco progress note, which I'll talk a little bit more about later as well. So having all of those pieces in place led us up to starting a pilot billing process in January of 2017. So we just started this a few months ago, where we are offering tobacco treatment services using both registered nurses and tobacco treatment specialists, providing individual and group tobacco treatment services. So again, I'm going to come back to those pieces. I just wanted to touch base a little bit more on the staff survey findings. I'm not going to go too into depth on this. You can look at it later, but I just wanted to point out that doing this was really helpful for our organization, and it helped us kind of discover where we might hit some barriers down the road as we implement some of these changes in policies and adding in additional services. For example, 85% of our staff agreed that offering tobacco treatment is consistent with our mission. So that just gave us a little backing on saying, hey, we're going to be adding in these services. There are going to be some changes, but we heard from you that this is something that you agree with. In addition, things like continued tobacco use makes relapse more likely. 36% of staff agreed, where we know that studies have found that treating tobacco during addiction treatment increases the likelihood of abstinence from alcohol and illicit drugs by 25%. So it revealed some areas where we needed some additional training. So I really recommend doing that if you're getting started on tobacco treatment work at your organization. This was very helpful. And another huge barrier that it revealed was that 51% of our staff identified that they thought the biggest barrier to incorporating tobacco treatment services was lack of client interest, when in fact we know that 75% of people 75% of people in mental health treatment want to quit smoking compared to 60% of the general public. So again, just opened a door for us to say, hey, our clients actually do want this service, so let's do what we can to provide it. So this slide might look familiar. Amanda had a similar slide talking about the different billing options, and this is the codes. These are the codes that we are currently using to offer and bill for tobacco treatment services at People Incorporated. So again, we started a pilot in January where the pilot was started at one of our programs. It's called Stark Mental Health Clinic. It's an outpatient mental health clinic where we see clients from all over the Twin Cities, 2 providers, including myself, a tobacco treatment specialist, and a registered nurse. The pilot started with the 2 of us just offering one-on-one tobacco treatment services. So a lot of people were involved in this, even though it was just the 2 of us offering services. We had the client's primary therapists and or a medical support specialist conducting the tobacco screening that I referenced that we created in our electronic medical record. And on that tobacco screening, the client could elect if they were interested or if they wanted to be referred to individual tobacco treatment sessions, group tobacco treatment, an appointment to discuss NRTs, if they didn't want any services, or if they wanted to be referred to outside programs. So if a client elected that they wanted to be referred to an internal individual tobacco treatment session, that was set up with the therapist or the medical support specialist that did the screening, and then myself or Tacey would meet with that client. And at that first meeting, we would complete the tobacco treatment order that we created in our electronic medical record, which would then need to go to the physician, in this case a psychiatrist, to sign off on ordering those services. As Amanda spoke about earlier, since myself and the registered nurse were providing the services as a physician extender, the services have to be supervised, and the psychiatrist has to oversee those services. So their approval and signature is required to approve their ordering, and also they need to sign off on the progress note that has to be completed after every session. So during that first session, we completed the order as well as progress notes, which then are submitted to be signed off on by the psychiatrist. After that, at that first appointment, if the client was interested in ordering NRTs or getting a prescription for an NRT, that's something we would also discuss at that time, and that would also be passed on to the psychiatrist if it was decided that that person wanted an NRT order at that time. So that's where we started, just with those individual services. At this point, we screened a little more now, but a few weeks ago, the numbers we were at were we had screened 23 clients, with 8 clients electing to receive services. So we're at about a 35% rate of people that say, yep, I do want that service, which I think we've all been pretty surprised at the high rate of interest and people signing up for these services. So that's really great. Let's see. So what we have found from just a few trials that we have done, the majority of our clients, I should say, are Medicaid and Minnesota Care. So these claims are coming back paid, and they've been covering the NRTs, which was no surprise. We know that we have pretty decent care with the quit meds and tobacco treatment for MA and Minnesota Care clients. We weren't surprised to find this, but we had a few Medicare clients who were interested in services, which Medicare does not cover the service. So in those cases, we are offering sliding fee scales. We definitely don't want to turn anybody away. So we are hoping to be able to provide some financial assistance for those folks that need to take advantage of the sliding fee scale. Again, not wanting cost to be a barrier for anyone. We do have a handful of clients, of course, that have private pay, private insurance. So depending on the payer and the plan, it's going to look very different whether coverage is there or not, and that's just an ongoing learning experience and something we always, just consistently refer to the client that it's better to check with their insurance than to assume one way or another. So that's what we found as far as what we've been reimbursed for. Again, we're at the beginning of it. But things are going well. Reimbursement's going through. It's been really great to actually, put these codes into practice and see what happens. Some other tools and successes and things we've learned. Again, the training and education piece has been really important, and therefore the screening as well. The staff survey to help us figure out what kind of training and education that we even needed, and providing training that really was reflective of what we learned from the staff survey. We found that a majority of the resistance from staff revolved around misinformation around tobacco treatment and mental illness and chemical dependency. For example, this belief that people living with mental illness or addiction don't want to quit, which statistically is just not true. So just looking at some of those things was really, really helpful for us. Also, additional training for RNs and prescribers around tobacco treatment. What we know is historically a lot of people have been under-prescribed, like with NRTs, for example, or people not knowing about the safety of dual NRT use, things like that. So really focusing on pharmacology training has been really helpful too. Transparency and open communication, of course, that's kind of a no-brainer. But realistically, it's huge with this because tobacco can be a pretty touchy subject. People have pretty strong opinions on this. So as we move towards new policies and procedures. We just want to make sure all staff at every level are on board and aware of what's going on. Availability and access. So the biggest barrier we had been seeing was hearing from clients about the lack of tobacco treatment programs. Not only clients, but I've also been hearing this a lot from other professionals in the field. Oftentimes when I have a conversation about tobacco treatment with other programs, they are wondering if they can refer people to ours because everyone's kind of hungry for more places to be able to offer this service to their clients. So we're hopefully going to be seeing that coming in the future. We're definitely hoping to ramp up our offerings and spread this pilot to various programs of ours throughout the Twin Cities. Ideally, to start with, we'd like to see at least 4 or 5 different groups going on throughout the Twin Cities, and that would be like potentially at like some of our satellite outpatient mental health programs, and at those programs we would also be able to offer individual services. So just continuing to increase that availability so that the clients who are in need can access those services. NRT availability is another huge one. Looking for more creative ways to offer it to people whose insurance doesn't cover it. That's something we're constantly trying to increase our resources on. Another big thing that we learned was using the benefits of using a curriculum and educational materials with clients in tobacco treatment sessions that really meet them where they're at and that aren't just focused on quitting. Because what we know is a lot of people aren't ready to quit, and as soon as you start talking about quitting, they're just going to shut down on that topic. So the curriculum we use really focuses on education. It has a really strong educational component. So if someone's not really ready to start talking about quitting at that point, we can still meet with them. They don't have to be ready to quit. Again, we have had 23 screenings with 8 referrals out of that, so 35%. Again, this is a small sample. I recognize that, but I do expect, just based on some of the other research we've done, I do expect it to continue to have a pretty high rate of clients wanting this service. And just to touch on groups, we have 1 active tobacco treatment group at this time. We have not done any trial billing around that, but in 2 weeks we are starting another tobacco treatment group where we'll be piloting the billing codes for that service. So a lot of fun stuff still to come, but that's a little bit about what we have going on at People Incorporated.
Thank you, Jamie. You gave a very nice overview of the types of services People Incorporated is offering, as well as some of the background with the partnership that we have been able to work with People Incorporated on fulfilling some of those services. I do want to share a little bit more about what the American Lung Association is currently offering for support and guidance to organizations interested in addressing tobacco among people with mental illness and chemical dependency. We know addressing tobacco use through trainings, assessments, and integration contributes to the success of overall well-being in both staff and clients, and increases cessation opportunities while decreasing secondhand smoke exposure. So we know that every organization is at a different stage of readiness in addressing tobacco use with clients and staff, and the American Lung Association Minnesota really meets organizations with where they are and works with them to develop sustainable integrated trainings, policies, and procedures at their pace. So on the screen here is just a few opportunities that a partnership with you could offer. So we can review current staff and client commercial tobacco use policies, provide staff trainings on current beliefs and barriers surrounding commercial tobacco use, provide online and in-person trainings. As Jamie talked about, we really kind of review the staff survey and think of creative ways to provide trainings to the staff around tobacco. Site-specific tobacco-free grounds implementation timelines, thinking about organizational buy-in tools and presentations, so taking maybe some of those results and opportunities and putting them into place where it's really showcased and communicated amongst the organization in a creative way. We could also provide carbon monoxide monitors, look at individual and group tobacco cessation treatment support, and then provide access to evaluation and communication strategies. And then after the intensive year-long partnership, we provide ongoing technical assistance and training to the organization to really combat any other barriers and celebrate successes together. I will be sending out a link in the post email of kind of what that would entail, and also there's a readiness survey, so stay tuned for that in the post email. At this time, I did see there are a few questions come through. If you do have questions, you can use the chat feature in the corner to chat those in. We did have one question about how do we go about applying, registering for the tobacco treatment specialist training and certification. Jamie, would you mind kind of going over what that looked like for you?
Yeah, no, definitely. So first off, I would highly recommend the training. It was a really great experience held at the Mayo Clinic. It's a 5-day training, so Monday through Friday. It's pretty intense. It's all day and a lot of great information. They really have a good team out there that puts together a really comprehensive training. It does fill up pretty quickly, I believe. At least it did when I went about a year ago. But if you go to their website, Janelle, maybe we can include like the link to the page and what you're sending out afterwards, but I believe it's probably pretty easy to find just on their webpage as well. But it will list all the dates of the upcoming trainings. The next one is in June. But there are a handful of them throughout the year, and I believe the cost right now is $1,250. I was just looking at it and hoping to maybe send a few more people from our organization, but that's the cost of the program. And again, it's a full week, and at the end, on the Friday of the training, you take a test, and I don't remember what score you have to have, but if you pass the test, you become a certified tobacco treatment specialist and are then eligible to provide tobacco treatment services as a physician extender. So highly recommend that.
And then as far as keeping up that credential, what are some things that one might have to do?
Yeah, so depending on your educational background, after you complete the certification, you have 2 years to complete a certain amount of hours of direct service with clients. So for me, I have a master's degree, so for me it was 240 hours over a 2-year period. So not too, pretty doable. It's for, I don't remember if it's an associate's degree or a bachelor's degree, but the hours that you need increase with that to about, I think it's double, so 480 hours over 2 years that you need. So if you don't get that, it voids the training. So it's really important that if you go through the training, really making sure that it will be built into your weekly job or, to make sure you get those hours. In addition to that, I believe it's 18 CEUs that you need a year. So not too bad, just some things to keep in mind. Oh, 480 for bachelor degree. I just saw somebody type in. So yes.
Thank you. How about any other questions from participants? There was also one about to be eligible for QUIP plan, do you have income guidelines? Amanda, can you take that one?
Yeah, the short answer is no. So individual QUIP plan services, so those basically everything but the QUIP plan helpline, is available to everyone in Minnesota regardless of income or insurance status or anything like that. The QUIP plan helpline is the only place where there's some eligibility requirements, and basically the QUIP plan helpline is only available to those who do not have health insurance for phone counseling for cessation or patch, gum, lozenge, nicotine replacement therapy, that kind of thing, but no income guidelines.
Wonderful, thank you. And another question for Jamie, did People Incorporate develop their own curriculum for group therapy, or do you use an existing curriculum?
Yeah, that's a great question. So what we're currently using is the curricula. It's a curriculum, and it's called Healthy Living, Tobacco and You. And it was developed by Dr. Jill Williams and some of her colleagues, and is a curriculum designed specifically for this population, being individuals with behavioral health diagnoses or chemical dependence. And it's a great curriculum. It allows kind of two different tracks. The first one, like I was saying earlier, is more, it's positioned for clients who aren't necessarily ready to quit. They aren't as far along on the stages of change, and it offers a handful of different topics it's a more of an educational based curriculum. And the second portion of the curriculum focuses on creating a quit plan. So it moves through setting a quit date, preparing for that quit date, and then post quit date, maintaining and dealing with setbacks and things like that. So that's what we're currently using.
Thank you. And another question about, do therapists need special training in order to bill for smoking cessation groups, individuals?
This is Amanda. I can try to take that one. So as far as I'm aware, if someone is already an enrolled provider with the state under Medicaid, then they should be able to use those codes that both myself and Jamie put up there to deliver services. If therapists, because it's such a broad term, if it's a master's of social work or that kind of thing, their best bet of getting reimbursement would be to have their tobacco treatment specialist certification and then bill as if they were a physician extender, at least for the fee-for-service folks. But I can follow up with DHS to ask them specifically about licensed therapists who are enrolled as a provider for Medicaid and make sure that they're on that list.
Wonderful. And then same would go for like master's level mental health professionals?
Right, correct. So it looks like the question was on reimbursement rates, and Jamie, you might know this better than I do, but my assumption is that reimbursement rates are the same for generally across providers. They might be different if you're considered a physician extender versus an enrolled provider, but you might know better about cost differences.
Yeah, what we've seen, we've really only tried with both the registered nurse and the tobacco treatment specialist, and reimbursement rates have been the same regardless of who the provider is, because it's being provided as a physician extender with both licensures.
And Jamie, do you happen to know the rate of the reimbursement, or does it depend?
So it depends, but let's see here. I can back up a little bit to show like what so it'll be approximately, you can all still see this same slide that I just pulled up, correct?
Correct.
Yeah, okay. So that has the reimbursement rates for the individual and the group services based on, for individual, it's increments of 15 minutes, and then the groups are either 30 or 60-minute sessions.
And then just to confirm, a psychiatrist or physician needs to sign off on all treatment notes from the tobacco treatment specialist?
Correct. Yep. So we have it set up in our electronic medical record if I see a client, I will complete my progress note and I'll sign it, and then I choose who I want to send it to, and I will select the psychiatrist that's working at that program and submit it to them. They'll review the note and sign off on it at that time.
Thank you. And then there was a question about managing smoking breaks, specifically if your campus is looking at going smoke or tobacco free.
Yes, so that's definitely part of the work we're doing with the American Lung Association. It's still something we're exploring, playing around with. We have got a lot of people at the table, HR, communications, Janelle and her team at the ALA, and figuring out what that's going to look like for us. I will say that we're exploring it. We don't have an exact timeline or plan in place yet, but yeah, we're exploring what would it look like to move in that direction of tobacco-free grounds, or even taking baby steps in that direction of adding additional policies in, such as regulations around no smoking with clients, things like that. So we're moving in that direction, but have quite a bit of planning and preparing around that piece still.
Right, and so often we hear that individuals in treatment programs often see staff using tobacco products and consider it the norm. And also, we also hear of people going through treatment programs where because of the smoke breaks, they learn to pick up smoking to socialize. So that's something that we can do is work with organizations on kind of looking through it that lens and implementing some policies that could help disturb some of that normalization. And another question about to clarify, would a licensed mental health professional like an LPC still be required to have a physician or psychiatrist sign off on notes if trained as a tobacco cessation specialist?
This is Amanda. That's something else that I'll check with DHS, and maybe Janelle and Jamie, between us, we can come up with a list of all the different types of healthcare professionals that might be delivering these services. And then we can send DHS a whole list of all these types of professionals. My assumption is that if they're an enrolled provider with Medicaid, that you should be fine and won't have to fall under that physician extender category. The main caveat with physician extenders are these are not people who are eligible to be enrolled formally, if you will, into as a Medicaid provider, which is why they have to be supervised by a Medicaid provider.
I would guess LADC, licensed alcohol drug counselor, would kind of follow along the same guidelines too. So yeah, why don't we develop a list of professions that we can ask DHS about, and if anyone else has recommendations to submit, we're happy to do that. And I will send it out as a post-communication email. Yep, thank you. All right. Last call for questions, comments. One on for clients who are motivated to quit e-cigarettes. Is the curriculum inclusive for those folks?
Yes, that's a great question. So it is, but I mean, that's just a really good point to bring up. As we built everything into our electronic medical record system and our policies and procedures, it was really important to have and to acknowledge what our definition of tobacco was. So for us, it includes e-cigarettes, and we make sure to reiterate that everywhere in our policies and in our standing orders, in our screenings. So it does really position itself well to work with people, whether it is smokeless tobacco, cigarettes, e-cigarettes, and also calls out the difference between working or using tobacco, and then also is culturally sensitive around tribal tobacco use as well.
Wonderful. And we also do have a series coming up that will be providing free CEUs to licensed alcohol drug counselors, LPCs, LPCCs, starting next week. We have Tony Klein, who is an addiction counselor from Rochester, New York, will be providing a series of webinars and technical assistance calls every couple weeks until about early June. So I will be sure to send you that information too. If you are not already registered for that, please feel free to do so. They are all free and available for you. So thank you again so much for everyone for joining, and thank you to Amanda Jansen and Jamie Indica for today's webinar. Be on the lookout for that email with the slides, recording, and other upcoming opportunities to stay engaged in the conversation around tobacco addiction among those with mental illness or chemical dependency. Thank you, everyone, and have a great rest of your afternoon.